Hello, and welcome to the fourth and final event in the Health System Innovation Series that Matter is producing with AVIA. From discussing how to align stakeholders and hearing from CXOs across the board to measuring impacts of digital deployments, today we close out the series by hearing collaboration journeys from entrepreneurs and their health system collaborators. My name is Colleen Wisniewski, and I'm the Marketing Director at Matter. Matter is a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare. We do three things in service of this mission. First, we incubate startups. Since we launched in 2015, we have worked with more than 800 companies that range from very early to growth stage startups, and we have a suite of services to help them at every stage of development. Second, we work with large organizations such as health systems, life science companies, and payers to strengthen their innovation capacity. We help them find value in emerging technology solutions, empower internal innovators to unlock the value of their ideas, and create a more human-centered healthcare experience through system-level collaborations. And third, we are a nexus for people who are passionate about healthcare innovation. We bring people together to be inspired, to learn and to connect with each other. We produce a lot of programs, including large-scale events for the broader community like today, as well as small forums exclusively for our members. We're delighted to have worked with AVIA on this series and look forward to today's discussion on stories from health system implementations. We're joined today by leaders from two startups, Wellsheet and Notable, and two speakers from health systems they have built strong relationships with through their collaborations, Concord Hospital and the Medical University of South Carolina. AVIA's Senior Director of Digital Health and Transformation, Zain Ismail, will moderate the conversation. Zain is a seasoned health innovator strategist and entrepreneur who has led innovation in health systems in the US, Canada, and East Africa. He strives to improve the patient experience and deliver value to health systems by implementing novel practices when called upon by organizations in need of structure, creativity, and an understanding for consumer needs. A couple housekeeping items. If you have questions for our panelists throughout the program, please put them into the Q&A function in your panel below on the Zoom panel, and Zain will weave them into the conversation as appropriate. And with that, I will pass it over to Zain for a few additional remarks and to begin the panel discussion. Welcome, Zain, and thanks for being here.
Hey, thank you, Colleen, and thank you all for being here. It's a pleasure to be here and work in collaboration with Matter on this webinar series. Just very quickly, for those of you that don't know who we are, AVIA Health Innovation, we're a membership-based network of about 60 hospital systems across the country. And the AVIA team, in collaboration with our members, we work to accelerate digital transformation across the country. Like I said, primarily working with hospital systems, really to think about formulating their enterprise-wide consumer-facing digital strategies. We help select technology and then ultimately prepare them to implement their innovations. Really, that's our bread and butter. And so me personally, very excited to be a part of today's discussion. My team and I, we see the good, the bad, and the ugly every single day when it comes to health systems partnering with solution companies and startups to achieve what hasn't been done before. And so with that, wanted to start to set up what the case studies will be that we'll cover today. And so, as Colleen mentioned, we have four wonderful guests with us here today. The first is Dr. Christopher Fore, who's a Chief Quality Officer at Concord Hospital and Health System, and Craig Limoli, who is the CEO and founder of Wellsheet. And so together, they're working on reducing clinician burnout, which I heard is a thing, clinician burnout, as they think about implementing Wellsheet's smart EMR user interface. And so I want to welcome them both. Y'all can come on camera and be seen. Thank you, thank you. Next, we have Crystal Broj, who's the Enterprise Chief Digital Transformation Officer at MUSC, or the Medical University of South Carolina. And must say that MUSC is one of our members, and so we work with them very closely. And she is joined here by Neal Vachhani, who leads client services at Notable. And together, they are working broadly to transform the health consumer experience with some of Notable's notable automation platforms. And so very very excited to have them here today. Before we get into questions and start to understand their case study, would love to just get a brief intro from each. And so maybe starting with Crystal, tell us a little about who you are and what you're up to.
Thanks, Zain and fellow panelists. Excited to be here to talk to you today. I'm Crystal Broj. I'm the Chief Digital Transformation Officer here at the Medical University of South Carolina. This is a brand new role in a brand new department for MUSC. I started here about a year ago and started building up a team to provide digital transformation. We're working on a digital front door, really our consumer experience, and trying to make access easier for our patients and consumers. So I'm very excited for the work that we've done. Very thankful for the partnership with AVIA, and we really have some good stories to tell about the partnership we've had with Notable. So excited to get into that as well.
Fantastic. Neal, tell us about yourself.
Yeah, good afternoon. Neal Vachhani from Notable. Pleasure to be here and joining Crystal and all of you and the audience. I look after our implementation, integration, and customer success teams here at Notable, and take great pride and joy in accelerating and enabling the digital transformations that were just being discussed. In particular, making sure that patients have a consumer experience that they expect, have come to deserve, patiently waiting, and allowing care teams and staff to get more scale through technology, kind of a 10x multiplier. And also, and lastly, and importantly, enabling health systems to continue driving clinical, operational, and financial performance, especially in the current state that's very important for their sustainability.
Thank you for being here, Neal. Let's go to Chris next.
Good afternoon, maybe good morning, the central part of the country or the western half. My name is Chris Fore. As mentioned, I'm the Chief Quality Officer in a 3-hospital health system in central New Hampshire, so up in cold, snowy northern New England. I pick up additional accountabilities for hospital-based providers and specialty providers with a real focus on flow access, growth, and performance, including length of stay. So I've kind of an interesting hybrid role. I'd say we spend a lot of our time here at our health system achieving strategic goals. I think some of the things Crystal mentioned, Neal mentioned, are very much in the window of opportunity for us as well. So I look forward to the conversation today.
Fantastic. Thanks for being here, Chris. And it sounds like you're bored. You have nothing to do all day. Over to you, Craig.
Thanks, Zain. Craig Limoli, founder CEO of Wellsheet. Really founded the company after working at IBM in their Watson Health division. That's where I saw the immense frustration that clinicians had with existing technologies and EHR systems in particular, not really being designed for them and meeting their needs and their clinical workflows. So we set out to create a solution that seamlessly integrated and embedded within existing EHR systems and addressed those pain points and gaps in the workflows that those systems were really kind of forcing clinicians into. So we've been fortunate to collaborate with Concord Hospital and many other health systems to achieve results around reducing clinician burnout, as you mentioned, Zain, reducing time in the EHR by as much as over 40%, and increasing patient throughput and addressing length of stay needs as well. So looking forward to sharing more about how we collaborate with Concord today.
Fantastic. Well, I'm excited to have the 4 of you here because, certainly in our prep call, we had discussed, some of what y'all are doing is very clinician focused. What MUSC is doing is a little bit more patient focused, but there's certainly a clinical piece to that. So I think it's going to be a wonderful discussion, and hopefully we can surface some insights, some of the good, some of the wins, and maybe share some hand grenades or the bad that those that are listening today can learn from our mistakes. That's for sure. Well, let's start to dive in then to what exactly is it that you all are working on. And so would love to maybe start with Chris here as the hospital leader. Chris, could you tell us about ultimately what is the problem that you're trying to solve, that you picked up the phone and called Craig and say, hey, we need your help, or you discovered that you needed a tool or a capability that they were working on? Would love to start there. What is the problem that you're ultimately noticed and we're trying to solve?
Yeah, thank you for the question. I think our relationship began back in 2019. Our previous CMIO had established a relationship with Wellsheet. And I think at that time, we were really trying to address the issues that Craig spoke to, the user interface, time in the EHR. We had actually implemented Cerner, a single instance of Cerner throughout the entire enterprise, including ambulatory. And I think there was definitely a push to help people, give them tools that would help them be more successful, make data visualizations more workable, and just make the user experience better. And we did some cool stuff from the very beginning. We had some ideas about how to embed interactive tools. Wellsheet does a really good job of pulling discrete data and information from your EHR in a way that most of the EHR platforms will not, to introduce discrete data into data calculators and such. So we were off to the races, but then COVID happened, and I think our perspectives changed, and what we needed the system to do changed. And quite honestly, probably why we're speaking and why we have a good relationship with Craig and his team is they were incredibly adaptable. And we basically transformed the project also into something to help us keep track of census and acuity and location and status for COVID patients. And then learning forward, we've actually used that in a lot of other ways that I'm happy to talk about more as we share time together today.
Fantastic. Craig, what would you add to that from your perspective?
Yeah, so we certainly, when we deployed in late 2019, did not see a global pandemic coming a few months later, and it was really an opportunity for us, I think, to support Concord in that time. So, we had a COVID-19 dashboard available for them that launched in mid-April of 2020. So. Very, very rapid turnaround time to introduce functionality that was then used, really leveraged as a core part of their response to the pandemic, tracking the patient census, where they stood from a testing perspective, room availability, and other key metrics across the hospital being tracked in Wellsheet across the pandemic. And what we found since COVID has thankfully died down of late is that a lot of those tools have been really helpful for overall throughput management and tracking patients across the hospital. We've developed, even as part of the pandemic response, part of the functionality was around real-time notifications for new results. So if you're waiting on that, those COVID tests could take a day or 2 or 3 in the early days to get results back. So you wanted to be notified immediately as soon as that's available. And we found that that's translated really well to other test results, or if you're waiting on an MRI or consult to complete, the things that oftentimes hold up kind of the next step in care or a successful discharge for a patient. Being able to be notified right away when that data is available in the EHR is really powerful. And so we've had the opportunity to evolve that and make it really useful broadly across Concord and other clients that we work with.
That's wonderful. What I'm hearing there is sort of this notion of serendipity that, once you enter into a partnership or an innovation relationship with someone, you just never really know, especially in the early stages, where things will take you and what new ideas can come to the forefront.
It didn't feel like serendipity at the time, but certainly there were some aspects of that.
Would love to turn it to the other side now, to MUSC and Notable. Crystal, as you all, thought about your relationship with Notable, again, what was the problem that you said, gosh, we're really struggling with this or these things, we need a group like Notable to come and help us?
Yeah, we were working on patient access for the most part and trying to meet people where they were. We started with registrations as part of a digital front door aspect. We're an Epic client, and as we sent out notifications to folks via email, we get about a 23% response rate for people to pre-register. And so we contacted Notable and asked them to partner with us. And so what happens is Notable will send out a notification via email and text in about 90% of them are actually answered back in text. That's where people really want to get that notification from, saying, hey, you've got an appointment, Zain, 3 days from now. Do you want to confirm, cancel? If you say confirm, then it will let you pre-register with your driver's license and your insurance card, and it reviews all the information that you have for your appointment ahead of time, so that when you walk in the door, you've got all your registration done. We've had really, really good response from that. I think we've had over 1 million contacts so far since we went live in December. We have a 97% satisfaction rate with our patients, and a lot of really good learnings from that. At the end of the experience, the patients can give a thumbs up or thumbs down. Either way, they like to give us comments about whether this worked well, whether it didn't work well. And that was one of the things that was great, is we partnered with Notable. We made a lot of changes in that workflow, how we did things, from combining appointments. So if you had more than one appointment in a week, we learned that, people don't want to get 3 text messages about that. So we'd send one and you could register for everything all at once. We included this fall a Spanish option. So now we if you have that as your primary language, you can actually answer it in Spanish. So these are all things that, because we worked so closely with Notable, we were able to make these changes and add these little wow moments to the experience for our patients.
Fantastic. And Neal, what would you add to that?
To add on to what Crystal described, what we found is that patients are, when they're engaged, they're just much more invested in that care journey and that care experience. So through that intelligent intake experience, they're also paying their copay in advance. They're completing all clinical forms and questionnaires. And it's dramatically reduced the no-show rate into the clinics as well, because they're committed to that visit. And we all know that access is hard, and those precious slots in the schedule need to be utilized as efficiently as possible for the providers and for the patients alike. So it's been really impressive to see that improvement as well.
Fantastic. So there's a lot of folks listening on the call today who are from the technology community. They're either working, creating startups in small companies, or larger enterprise companies. And so I want to ask, particularly our hospital leaders, as you've been navigating these partnerships that we're talking about today, but certainly others in your long and tenured careers, wanted to ask about what makes partnerships successful from your perspective. And Chris, would love to ask you the question first, and then we'll see what Crystal's opinion is on that one as well.
Yeah, I think I keep wanting to go back to that word partnership, and the second word I want to focus on is being nimble. I think probably the key to success is just understanding, what does the customer or the consumer or both need, and what are their problems, what keeps them awake at night, what's in their strategic plan, what are their accountabilities, what are they trying to get done. And I think that has been a strength of our partnership, and that Wellsheet in particular has been very nimble. They've got a great team, and I feel like I can reach out to anybody in the executive team and get pretty quick feedback, or share an idea, or bounce something off of each other, which I think that's not terribly common. And I think a lot of new products, even startups, even when they're young, oftentimes come to you with, this is the product and here's what it does, please buy it, and just bolt it in, everything will be great. And I think that doesn't necessarily work for guys like myself, who are accountable for adding value to the health system, trying to get a business objective satisfied. So it's never really that simple. So I think that's what it boils down to me.
Crystal?
Yeah, Chris, I think you're spot on. Being able to learn and grow with each other is a big part of partnership, right? You can have a vendor, and that's just a total transaction. They sell you something, you install it, that's it. Then it's sort of like, okay, it's all yours. But a partner walks down the road with you and is really invested in making sure that project is successful. And they have skin in the game too. They want to see you succeed. They want to make sure that you hit those KPIs. They're standing side by side when you're going to senior management with you with okay, your KPI was this, or we were looking for this, we didn't get there yet, so what are we going to do to change it so that we can get a better outcome? And I think we've really had and we've refined our KPIs. And Neal, you know, we've had a lot of discussions about KPIs and what we're trying to hit and what we can measure and what we can't measure, and try to do that. And we've worked through a lot of that together as well.
Fantastic. So what I'm hearing from both of y'all then is, call it not a vendor relationship, but call it maybe a true relationship where we're willing to be vulnerable and flexible and pivot where we need to, but also stay in constant communication around where things are performing and probably where they're not. Want to flip the question then to our technology companies on the call. Certainly at Avia, in our business, we're primarily aligned to our hospital system members, but we also take a lot of phone calls with technology companies. And sometimes they tattle on our members. And so I know that dealing with hospital systems, whether they be small or large, academic or not, or rural, can be a challenge. And so curious from your perspective, and maybe we'll start with Craig on this, what makes a great health system partner? And would love to hear too, maybe stories from the trenches of maybe a poor partner and what happened.
Yeah, absolutely. We've had all kinds of experiences, and we work with health systems that really kind of run the gamut in terms of size and complexity and bureaucracy. With some of the largest in the country, with hundreds of hospitals and then small clinics. It's highly varied across our client base. Everyone has an EHR, and everybody has challenges with that. So we serve a broad market. And there is, every health system is different. It comes with their own set of challenges, and you kind of have to learn it as you go about how that particular customer operates, what they like to see, how they like to do things, and you do have to have some nimbleness, some flexibility to that to really get the engagement model right with each. But I think at the end of the day, what it comes down to, and what really makes a success out of these is trust. And whenever you're starting a relationship, that is still, needs to be built. So it takes some time, and you need to prove yourselves and deliver some outcomes and results, and then over time, what we find is it becomes easier and easier, even with the toughest health systems, in terms of having a lot of red tape and approvals, which Concord is not, by the way. We love working with systems like Concord, where they have visionaries like Dr. Fore and team, and we can go on site and visit and engage with the leadership and get their feedback, and end users directly at the elbow, and hear their thoughts on the product to continue to advance the functionality, ensure it's meeting their needs. But it's always a matter, I think, of really building that trust over time, and that unlocks so much additional partnership opportunity. So it really matures, over the months and years that we work with our clients.
Love that. So what I'm hearing there, obviously, is the trust, which you explicitly spoke about, but in some of your examples, really you're talking about like openness and access to the team to really have discussions about what is it that we need to do here, what are insights from our customers that we need to pull into the product, so on and so forth. Neal, what about you? What, in your view, and if I'm comparing the companies, I know Notable is probably a little bit larger and has a bit broader risk scope. Curious, what have successes with hospital systems look like? And if you have any tea on when things have gone south, would love to hear it too.
Yeah, sure. Happy to share some thoughts on that. I think there's a couple of scars and skills, as we like to describe them in Notable speak, that we've built over the years. And I think there's a few. First, to your point about there's a lot of different jobs to be done, potentially, many different use cases for technology in health systems. So I think it starts with a mutual understanding of what's the biggest pain point that we want to tackle right now. And to the conversation we've had earlier, that might change over time, and that's okay. And the second thing that's related is for us to be true partners to MUSC and countless other health system and healthcare organizations across the country. It's important for us to empathize with the current state that executives at these organizations are grappling with. And it's a tough situation to be in for many obvious reasons. And so a lot of what we are bringing is technology, but it's also the change management, the operational understanding of what it takes to actually make change happen inside a healthcare organization. It takes persistence and grit over time. And so I think, when I think about what makes a good partnership, it is a mutual understanding from day one on what that journey is going to look like. And so for MUSC, as an example, very early on, there was foresight to say we need to have some sort of joint governance around how we make decisions, what's important at this point in time and when. Because you can otherwise have a lot of different voices, all well-intentioned, but you're just going to get stuck and not make decisions. And so I'd say great partners are ones where you can have a clear North Star, be decisive around what the goal is, how we're going to measure success, and then we steadily march through that and reaffirm when things are working well, but also have the humility to recognize if it's not, and then we can steer in a separate direction. The opposite can also be true, where you get stuck in the mud for long periods of time, and then it devolves into the blame game, and that's not pleasant for anybody. Which is, hey, I hired you to make magic happen, but it takes two to tango, and that's a true partnership. We realize that.
Takes two to tango. That's going to be the tweet we put out there to summarize the whole discussion here. Love that. Wanted to maybe transition the discussion here specifically around measuring success. And so I know, particularly on the hospital side, which we're closest to, hospitals are struggling financially. There's some pretty significant experience standards that health systems are pushing towards, as groups like Amazon and CVS and Costco and you name it, probably the Four Seasons tomorrow gets into healthcare. Health systems really need to start delivering beyond what they've ever done. And so wanted to maybe start with you, Chris, as you all think about your work with Craig and the team at Wellsheet. Specifically, how were you measuring success in that partnership?
Yeah, so that's a great question, and honestly, somewhere I hoped we would wander in this discussion. As I think as we've been engaged in this relationship since 2019, the playing field has changed pretty significantly, regionally, nationally. I think the financial situation of most people who deliver healthcare is much more challenged. We talk about headwinds constantly. And I think as we've moved forward, as I mentioned previously, a lot of what we're talking about now is we realize that the user experience is always going to be super important.
Sure.
But achieving those operational goals, those business goals, are also super critical now. So when you look at every organization's KPIs, what they're trying to achieve, there's going to be stewardship, sustainability, operational efficiencies, workforce productivity, vacancy rates. And, for me in particular, that's really impactful, and something we're working together on refining is if you look at something as simple as taking care of patients in the hospital, it's this huge, complex matrix team sport. People from different departments and divisions working together. And what we've identified in really trying to refine how we actually achieve our major KPI, which is inpatient length of stay. It's about information sharing. It's about teamwork. It's about how accessible and digestible is that information. And that's a direction we're trying to head in earnest right now with Craig and his team, is to figure out how can we leverage existing technology to do that better as well.
Fantastic. And Crystal, on your end, how are you all thinking about measuring success with your work with Notable?
With patient registration, we were trying to see how many registrations, and we increased that from 23 to 45, 50% now of patients that are actually registering before they come in for their appointment. We look at how much money we're collecting ahead with patient copays. We look at our no-show rates. That's huge. That's gone down 14% since we started using Notable. And then when we tie that in with Epic FastPass, we're getting people in a lot faster to be able to really service those patients. So those are things that we've been tracking all along. We embarked on several new adventures with Notable. One is really exciting is our breast cancer outreach, as we start looking at care gaps and trying to see if a woman has had a mammogram in the past year. And then we send a notification saying, hey, Crystal, it's time for your mammogram. And you can click right here to book that appointment. We launched that campaign. Not sure what the uptake would be, but wanting to get some uptake. in October of this year, and we had reached out to over 30,000 women in South Carolina. About 10,000, about a third of them responded. We were able to see that maybe they'd gone someplace else, or maybe it wasn't in the chart right, or maybe they, it wasn't really time or whatever that was. But about 875 women actually booked mammograms.
Wow.
And many of them sent us comments afterwards going, "Thank you for reminding me, I forget. Thank you for making it so easy to schedule." And so that's like a bigger win than anything when you start seeing that you're actually affecting lives of patients and being able to quantify that in a way that we haven't had before. And so that was super exciting. With that comes some downsides too, as we start talking about operational things. We sent out so many that one of our centers actually called and thought there was a mistake with the program because they got 200 scheduled mammograms that they weren't expecting, because although we told them it was coming, they didn't believe that they would get that much of an intake. And it actually changed the operational work that clinic is doing in order to support the women that are coming in. So technology isn't everything. Like Neal said at the beginning, it's handling the change management. How are we going to take care of our operational folks to handle the patients? Notable sat side by side with us on many of those calls with our operations folks to go, okay, what can we do here? How can we change this? How can we make this better for everyone? And that's where, when they're willing to be side by side with you, that's when you know it's a partner and not just okay, you guys figure out your operational stuff, you get back to me. That's not exactly what you're looking for when you're looking for a partnership relationship.
Right. In a sense, in your story there, what you all did at MUSC with Notable achieved kind of what we're all gunning for here in digital health, which is to use tools to engage patients, but maybe it was a little bit too much. So it highlights that need to get our staff ready, workflows ready, the change management piece, so that they don't get inundated with patients that, again, I mean, that's what we want to be doing, but it takes more than just the technology to get it done.
Yeah, it definitely does. And that's one of the things that we've really learned between having a fantastic project manager. Now we actually hired a change manager so that they can help that operational piece move forward. And those are things that we really learned to rely on our project manager and to add in, communications and things with our patients and be a lot stronger and more transparent with that.
Neal, did you have something to add to that?
Yeah, I was just going to make a comment, which is this idea of doing all of what we're describing, but at scale. Right. That's really what we're after as well. Of course, every encounter, every patient is very important. At MUSC, as an example, we're now supporting across over 760 departments, 3,000 providers. So there's just a certain scale and magnitude of patient volume, to Crystal's point, that you need to manage. And that's really, I think, where the holy grail is in terms of this kind of transformation, is doing it across the enterprise. And so being able to support that kind of service with reliability and quality is really important for us.
Mm-hmm.
And I'd say that we didn't start out going to 768 departments.
Right.
We started with a very small cohort in an agile way to, okay, we're going to roll it out to 5. Let's test and see what happened with 5 and get feedback, and then roll out another set and another set. I think we had 5 waves before we got to the 700. So we learned as we go and made changes accordingly as we moved forward.
Wonderful.
That's right, Crystal. That's a great point. And actually the scaling of that was one where between the first wave and the second wave, there's some number of weeks because you're working towards it. But then between second and third and fourth, they get tighter and tighter because there's now trust in the system and there's confidence that we can actually have this impact.
Love it. Sounds like an agile sprint to me. Chris and Craig, wanted to ask you all, similar to what Crystal and Neal walked us through, is there any stories you could tell about your partnership when we said, wow, Wellsheet is really working. This is amazing. What happened?
Maybe I can jump in first, Craig, and you can add your 2 cents as well. I think what we learned early on is that adoption curve is always going to be a bell shape. And I think you have to make sure that you don't give people any reason to dislike the product, to shift that curve to the right towards later and later adoption, and more people to just kind of reject the premise. And we didn't have that, but we definitely did have issues during COVID where all the air in the room was taken by COVID and the pandemic and responses, and operations and operational efficiencies were kind of on the back burner, and health systems were simply just trying to survive and provide vital community services. but I do think that's something everybody has to keep squarely in frame. And I think, you know, to quote Ron Adler's book, The Wide Lens, is when you look at that adoption chain, all the nodes on that adoption chain, all it takes is one node to break the chain and the whole thing hits the skids. And that's really, really easy to do. So I think, you know, for people like myself who are trying to, you know, achieve a business objective internally, I end up having to do a lot of detail work with constituents and stakeholders to just have a ready why, a nice elevator speech. You know, why are you encouraging me to use Wellsheet, Chris? Well, it's because we think this is really going to help you do your job. And walking around with information on your device in your pocket is going to be really, really nice. And when you leave work and can get notifications for something that's going to be impactful decision making and will actually give you back the most valuable thing you have, which is time, that's valuable. And I think you really have to be on the same page, you know, both Wellsheet and leadership teams here as to what we're trying to accomplish together.
Craig, would you add anything to that?
Yeah, I'll just say that, you know, I think the aha moment when working with health systems like Concord often tends to be we get feedback from an end user, and then in a matter of weeks they can see that feedback in the product delivered, deployed. It's like that responsiveness and receptivity. You know, as a feature, right? It really drives satisfaction by the users who are not at all accustomed to that level of attention and support and interest in really what they need. And that's really, I think, driven a lot of, I mean, everything starts with adoption. You cannot move the needle on length of stay. You cannot move the needle on quality outcomes if you don't have adoption. And we have been fortunate to see incredibly high adoption levels at our deployments, you know, 80% roughly daily active use of the product, which is, you know, really exceptional for clinical technologies that are add-ons to the EHR. And I think a lot of the reason why clinicians are so enthusiastic about the product is that receptivity. So really delivering on that, being there for them, having you know, an open mind and open ears, you know, to hear their feedback, and then actually executing on that feedback is a big part of what drives that satisfaction and adoption for us.
Thank you for that. And I love the, you know, anecdote you made around, you know, users seeing their feedback, find their way into the product, you know, virtually. I mean, 2 weeks in healthcare is basically instant, right? It kind of connects with some questions that we're getting into the Q&A. And let me pause for a minute and say to our attendees, if you have questions, pop them into the Q&A function, and we'll do our best to either answer them live or answer them through text. Our panelists here all have access, so some are typing. But one question that I love, which kind of connects with what we're talking about here, and it's a little bit tactical, so I'll warn you. But Ron Willis asks, he's asking us which project management methodologies are best suited for some of the work that we're doing. And maybe what I'd say is, let's broaden this question, say, what does your partnership infrastructure look like? And I mean, don't need you to put up a slide, but what I mean by that is, like, what tools are you using? What meetings are you having? Who's involved in some of those to actually make these things work? Because I imagine it's not just you, Chris and Craig, or Crystal and Neal. There's other people, things, and there's a process that's making this go well. And so maybe starting with you, Crystal and Neal, would love to hear a little bit about, you know, what are those tips and tricks that are orchestrating this relationship?
Yeah, I think we have a really good governance. I mean, starting at the top, you know, our senior leaders are involved quarterly with meeting with senior leaders from Notable to talk about setting the direction, you know, what do we do well? What do we want to tackle the next quarter? What projects are we going to take on? What adaptations do we need to make? But then we get into some very tactile stuff. Our project manager meets with the Notable team weekly I meet at a strategic level every 2 weeks to kind of find out how the past 2 weeks went. Where do we need to go? What's getting stuck? How can we move things? We have meetings with our clinical operations teams about once every 2 weeks. There's an IT touch base that we've added in so that they can keep in touch with our roadmap quarterly and as needed. So there's a lot of interaction with a lot of different players along the way. It's not just like a project manager and the vendor partner. It's all levels of the organization being involved with that.
Fantastic. Go ahead, Neal.
Yeah, I was going to say, so in addition to the structure, it's the style and the substance of those interactions as well, which is highly transparent, peer-like. Hopefully Crystal would agree. We joust when we need to, right? We're frank with each other. We'll point out each other's, flaws in our thinking only to get to a better answer together. The other part of it is it's highly data-driven, right? So even in this conversation, Crystal's quoted so many impact measurements and metrics because she's as fluent in the data as we are producing it. And so that puts us in a position to make the right decision for the patients and the providers alike.
Fantastic.
And I think that's a key thing with a partner. If you can't disagree for the sake of a better product, then you don't really have a partnership. If it's just like yes, yes, or no, I won't, or whatever. But we've had some really good high level, just heated discussions like, no, it shouldn't work this way. No, well, it needs to work like this, or no, that isn't going to work for us. And, that's important for us to move forward. And I appreciate having partners that are willing to actually have those types of discussions and not just, yes, ma'am, we'll do that, or no, but really tease out the best of the best.
Yeah, love that. And, if we were to create a list of, what were the categories of a good partnership, I think being able to disagree, but both parties not worried that, hey, this means we're collapsing the relationship. It's just we're arguing to get to a greater truth. I think that's what you're trying to say there. Well, what about you all, Chris and Craig, as you all think about the infrastructure that you've laid to manage this relationship? What does it look like on the Concord end and on the Wellsheet end?
Yeah, I'd say the relationship has been pretty straightforward, but I like the question. I think my initial response when I saw that question was, regarding what type of project management do you prefer? I'd recommend you just use project management, period, and do the diligence, have an iterative process. Make sure you know who's on first, who's on second, because I think as Crystal identified, when you start trying to corral people who are paying the bills, people who are the end user, people in clinical operations, an external vendor or partner, pretty soon there's a lot of moving pieces to manage. And my experience in leadership has been, and I'm sure I have done this a million times myself, is people can say 7 or 8 really pithy, brilliant things in a meeting that if someone's not writing it down and running those to ground, they just go away. And it doesn't end up getting executed on or being implemented. So I think anything you can do to have that level of diligence is really, really helpful. I think our CMIO and CNIO, one of whom I think is on this call, do a really good job of working, with Craig and team to make sure that we are prioritizing. Do we understand the big picture? So it's not just about what am I trying to accomplish? It's about what is the whole organization trying to accomplish? And I think, Craig's team has been very responsive to that, but maybe I'll let him pick up there.
Yeah, I think that's exactly right. It's all about having the right players at the table and having really open communication about those priorities. There are so many problems to solve. The danger is always trying to boil the ocean without really focusing on what matters most. So that I think is the most critical part, is really ensuring that our roadmap aligns with our customers' needs, the directions that we're heading are well informed by what they want to see, and having a constant back and forth and engaging with the senior leadership as well as the frontline staff, and getting their feedback and really understanding what their reaction is to existing functionality, to plan functionality, and basing our actual engineering build off of good data that we were able to get from that collaboration. and engagement with our clients, like Concord. So I think that is that prioritization, transparency, and feedback loop is really what creates success in the long run.
Love it. Great question came in from Greg Shannon. He must have been in our pre-show because we wanted to ask this question. But curious, I guess in a nutshell, both what Notable and Wellsheet does in a sense, you could argue a little bit, could be accomplished by a native EHR. And so I know there's a lot of technology folks listening on the call today. Would love to hear from our hospital leaders first, and then we can flip it over to our technology leaders. How did you all make a decision? Well, let's make it broader. How do you all make decisions at your institutions to say, hey, we need a partner versus using what we currently have to build? And then maybe where it makes sense specifically, how did you decide that your EHR wasn't good enough to pull this off and then went to pursue the partnerships that you're in? Maybe we'll start with Crystal. How do y'all think about that at MUSC?
Yeah, we have some strategic partnerships. And so what we do is look to see, does the partner have the tool, the technology that we need in order to do that? When it came to Notable, at the time that they were starting to court for that particular product strand, our EHR did not do texting in the way that we were expecting. They have since then, but we've already ingrained in Notable, and we really like the experience. But we also wanted to get into RPA, robotic process automation, and see how it worked on this phase first, because there are a lot of other places we want to use Notable for rev cycle, for referrals, for a bunch of other projects that we have coming up next year. So this was a good way for us to start in that area with a partner and really build that partnership and tease out what we can do next. So now Notable is a partner too. So when we come up with other RPA vendors, the first thing we'll do is, can Notable do it for us? And when can that fit in their product roadmap? And then from there, if not, we would entertain other tools. In the same way, we go back always and look at the Epic roadmap. I mean, we have to. Epic's the big player. They hold all our data, right? So we're always talking to our Epic friends and finding out what they can do and where who does what best and at what time do we jump from one place to another. And that's the dance that health systems have to do, is always looking at the tools that we have on site and who's moved up the ladder and when is it the right time to move on to that product for that particular piece of technology that you're looking for.
This would be the perfect time for an AVIA shameless plug for some of the work that we help our members navigating those exact questions. Chris, would love to turn it to you. How are you all thinking about your decision framework around when we need a partner, and then where it makes sense to specifically around when you use your EMR versus a third party?
Yeah, this goes back to the age-old question of, do you buy it, do you build it, or do you contract for it and partner with somebody? And there's never an obvious choice. However, I think everyone will try to use what they have to accomplish what they can. But I think in very particular strategies or tactics like the ones Crystal's measuring with access, there are times that the degree of content expertise or software development or design, the engineering just isn't there. Or if it is there, it's not as good as you can get externally. So I think in the case of the product that Craig and his team are producing, it was better than what we could do inside Cerner, especially when it had to deal with implementing our clinical care pathways for chronic disease management or some of the calculators. But I think that's always the question. You always have to ask, can we do this with what we have? And if not, what's the next step? And I think those external partnerships, you can't do it with everyone, but there are times when it can be very strategic in nature.
Mm-hmm. Love that. Well, next I want to ask, I guess, Craig and Neal a similar question. As you all, certainly what you do, Craig, marries right onto that EMR. And so it's a little bit different maybe than what Notable is doing, even though there's a strong integration. But curious, how do you all approach your partners and prospect clients, knowing that they've made such massive investments in their EHR, and there potentially is a potential that their native technology could do what you already do. So how do you approach those discussions? How do you talk to them to say, hey, Notable is better, or you need Wellsheet because? What do those look like? Let's start with Craig.
Yeah. So I think important to emphasize that what we do is not taking anything away from the investment that they've made in their EHR, and everything that we build is with a consciousness and awareness of what the EHRs do well and not so well, and it's really built in a complementary fashion that you can leverage Wellsheet side by side with functionality in Epic or Cerner. You can pull data from Wellsheet into your documentation in the EHR, or do your order entry side by side with Wellsheet open. And so it's a very embedded experience. You don't have to log in again. You don't have to re-identify the patient. It almost feels like a native EHR feature. And I think we also it's incumbent on innovators to deliver technologies that are clearly differentiated from what the EHRs can offer, and have an apparent gap in how meaningfully better that technology is, not just incremental but substantial. And so from our perspective, it's really important that we highlight that it's very complementary to the EHR, and it also does the functions that EHRs might not do so well far better. And then the third aspect is kind of the overall architecture, right? So if you're looking at an EHR roadmap, you're lucky if you get an upgrade once, twice a year. You got put in a month's worth of preparation for that upgrade process, and then oftentimes a lot of work patching, putting fixes in afterwards. And so it's just a much slower iteration and innovation cycle. And so one of the things that we express to clients and potential clients is that with Wellsheet, we're able to iterate on a weekly basis, right? So it's orders of magnitude faster in terms of able to deliver newer and better functionality, and there's no intervention required by the health system to gain access to that improved functionality. It's all disseminated automatically through our web application that's accessible to all of our clients. And so that's a very different model from what they're used to with EHRs, and enables that trajectory of improvement to be widening substantially over time rather than closing.
Fantastic. Neal, what about you? How do you all position yourself relative to the big beasts that we won't name in the EHR world?
Yeah, no, it's a great question. It's often the question. It's not lost on us that for any organization, there's a tax of having a multitude of partners to manage and coordinate with, not just to procure, but to manage and support on an ongoing basis. And quite frankly, our response is, if you're getting the outcomes that you aspire to as an organization, maybe you don't need us. Right? If you're actually creating the access that you expect for your community, and if your staff are delighted with their interactions with their technology today, and feel like they have enough time in the day to get the work done, you don't need us. But if those are not true, then let's have a conversation, right? And so we've been able, as Crystal pointed, to go from 1 in 10 patients being engaged to 60, 70%. We've been able to collect 4 or 5 times as many co-payment dollars. We've been able to cut down no-show by a factor of 15, 20% across our partners. And so ultimately it comes down to the outcomes that you're looking to get and achieve. And we stand behind that track record. And a lot of it's similar to what Craig described. We iterate with zeal as one of our 5 values. We work very quickly, so much so that we will surprise our partners, and they'll say like, well, how many months is it going to take for X or Y? And really it's more like this afternoon or tomorrow, the rapid cycle of changes that we can make. And our last thing now is we actually want nothing more than to empower our partners to make these changes for themselves. So we've recently rolled out a Flow Studio, which allows staff to kind of own big parts of that transformation.
Wonderful. That sounds like a clear ROI to me. That's fantastic. All right, as we get ready to close here, want to do some rapid fire from our hospital executives. Would love for you to give advice to the technology folks who are on this call. What is like your 30 seconds of advice? Be as transparent as you can to for them to work with you all and, lead a successful partnership with you all? Let's start with Crystal.
I think first, we talked about it all hour. It's trust, and building that trust. I want a partner that I can actually talk to, that I can actually sit down and have conversations with, and knowing that when I'm picking a partner, this is going to be somebody that I have to work with for months and months and months. So it's like hiring another teammate. I've got to make sure that I can actually work with them, no matter what their product is. But then too, if you're coming new, make sure you understand who we are and what we are, and don't just come with the, hey, what's your problem? And then when I say something, we can do that, we can do that, we can do that, have it solid what you think you're going to do for us when you come talk to us to begin with. And don't start and spend 15 minutes of conversation with, tell me about your world, and then tell me that you're going to fix everything, because that's not transparent and it's not real. And we all know it now.
I'm here and get to the point. Chris, what would you say? What's your advice?
Yeah, so 2 messages. The first is more practical. Just identify who the stakeholders are, figure out what is the capital request process. Ask the question, is this in the budget, or are you just kind of noodling on an idea? Because I think sometimes if you triangulate a clinical stakeholder who wants something, sometimes that becomes kind of arduous and really difficult to work through. So just figure out who the right people to talk to are. Folks like Crystal is a great place to start. I think the second thing I'd offer as advice is just to be a little inspiring to all these entrepreneurs out there, is just go do it. Go big, save the world. We're counting on you, and go get it done.
Love it. Love it. And then Neal and Craig, what would you say to your, as seasoned technology leaders in healthcare, what would your advice be to call it your community of digital health leaders? Let's start with Craig.
I would recommend really having an informed plan on how you're going to prove value going into any health system partnership or deployment. Really having almost a program that you can run a pilot, show outcomes, and then that will open so many more doors. Be okay with something small initially to really highlight your ability to deliver on what you're promising, and have a plan to translate that to scale. But really work with the health system to understand what they want to see, put together a plan, and execute that plan and deliver those outcomes. And then I think the broader scale and success should follow. And to the extent that you can reduce the burden for implementation, that's a big part of this as well. So I saw one of the questions answered in the chat was around Fire APIs. Those are a fantastic way, just as a more tactical piece of advice, to reduce that implementation time and effort.
Wonderful. Neal, over to you.
Be honest and be succinct.
All right. That was very succinct, by the way. Well, folks, we are at time, and so want to thank all of our panelists. It's been a privilege, as a member of the AVIA team working with Matter to put on this webinar series. We want to thank all of our attendees here. I think I can just say this, but if y'all want to reach out to us on LinkedIn, if anyone has any questions, I'm almost certain everyone on this call would entertain further discussions to both talk about the partnership or talk about the technologies being showcased today. And in my official closing talking points, I just wanted to say that a recording of this will be available in the coming days at matter.health/live. Keep an eye out for a survey. We want to know how we did here today, and we want to make sure that we're always bringing valuable content to the health innovation community. And then we'll also share that a recap of all the webinars that we've been done will be out there as well on matter.health.live for you all to engage in and share with your teams and whoever it is that needs to hear the insights that we're hearing from these executives here today. And so thanks again, everyone, for being here, to our panelists, our esteemed panelists, and to Matter for helping us co-host this today. Thanks, everyone. Have a great day.
Thank you.
Thanks, everyone.
Thank you.